I'm Dr. Rita Bakshi, Chairperson, International Fertility Center at Green Park, New Delhi. Let's talk of how to treat female infertility. Women have been blamed for infertility for a very long time, and if there is something wrong with them, it's probably not difficult to treat either. Starting from the cervical or the vaginal causes of infertility, and that means infections and antibodies. So if there are infections in the cervix or in the vagina, all you have to do is give her good antibiotics, local washing, local antibiotics, and clear out the infections. Antibodies, if they are killing the sperms, one can ask the man to use condom for a long time so that the body does not release antibodies against the sperm. As we go up into the uterus, and if you find that there are any adhesions, any polyps, any fibroids inside the cavity, then they can be hysteroscopically removed and cleared of the cavity. If there is tuberculosis, diagnosis of tuberculosis in the body or in the uterus, all you have to do is give anti-tubercular treatment for 6 to 9 months. The same thing will apply for tubal tuberculosis. Any STDs, if one finds, especially chlamydia, should be treated because that is what causes adhesions. Also, any other, for example, HIV, HCV, if one finds HBs antigen or one finds VDRL or syphilitic changes in the body, it should also be treated by the specific treatment. If there is an obstruction in the tube, one can have surgery, and if there is one single obstruction somewhere in the middle tube, then one can really cut out the obstruction, do a good tubal anastomosis and bring out the patency in the tube. Coming to the ovarian causes, if in the ovaries you find that there are a lot of eggs, that means it's a polycystic ovary, one can put the woman on the oral contraceptive pill for 6 to 9 months, suppress the ovary completely for it to form some good eggs after the suppression is removed. Coming to the endometriotic causes, which one finds when there is scarring and there is a lot of pelvic pain, then one knows that one is dealing with endometriosis. Endometriotic scarring can be done by laparoscopic ablation of the endometriotic spots, removal of the adhesions, and recreating the right anatomy for the right tubal pickup of the ovum. Besides this, if one does a general testing of thyroid and prolactin and finds that these are abnormal, then one can give specific treatment for the specific causes. In case one finds that still after having treated the woman in toto, there are still issues, for example anatomical issues, whether in the, if there are two lobes of the uterus and are not fused, one can do a fusion of the both lobes of the uterus to create one good uterine cavity. There are people who will not have enough uterus at all, then one should resort to surrogacy. Now that is a great option for people who have their ovaries, have their own eggs, have their partner's sperm, can be recreated outside, put into another woman's uterus, what is called surrogacy. So all the female causes have some or the other solution. It's important to just know that there is hope, that there is solution. Reach out for it. In case you have any issues dealing with the treatment of any female infertility cause, you're more than welcome to contact me on the details given below in the box. Thank you.